I am Kim Brown, and I am the ASC Director of OSMC Outpatient Surgery Center in Elkhart, Indiana. We also just opened a new surgery center in Granger, Indiana called the Surgery Center of Granger. OSMC has been open since 1997. We do orthopedics, spine, podiatry, and pain. We were physician-owned and then went into a partnership with a health system when we built our second surgery center. So that second surgery center has been open since June of this year, and also we'll be doing orthopedics, spine, podiatry, pain. So we implemented and started using it January of 2021. We actually started implementing it during COVID in 2020, so we had a little bit more time to work with it, but it's been a great experience. So we actually implemented HST practice management and eChart at the same time, which is not something most people do, but we had been on an EMR before with a different practice management company, so it just felt right to do it that way. We also have case coordination, which we've been using for our doctor's offices to be able to schedule. And then we also use Clarity for the price estimates, and then Catalyst for the estimates for the patients online. When I first came here, it'll be almost 4 years in September, we were using Vision from SIS, and I had used SIS products before. I had been with Advantix and stuff like that, but the Vision product here was very cumbersome. We were no longer getting updates, so we were having to actually write on the chart instead of clicking boxes and having signatures in there. So we were looking for another option, and so HST, I had heard from some other administrators that HST was a good option, so we contacted them. When we were using the other product, we would have to scan documents in, so we'd actually have the patient sign on paper. And that would be like the admission papers, the consent, the discharge instructions, and all of that. And then we would scan it into the chart at the end of the day or the next day. We would also have implant logs that we would have to fill out on paper and keep for a number of years in a binder. And so when we got HST, we actually got rid of all of our scanners. So we have the patient sign for everything on the iPad. We use the iPad for all of our charting. So they sign their admission papers, their consent, their discharge instructions, all on the iPad. So it makes it a lot easier. I also had contacted SIS because they did have the new product out, and we actually did demos with both of the products, HST and SIS. And we did that with the doctors, with the staff, with our management team, kind of looking at our billing team to make sure it would work for everybody, because our clinic does our billing. And that was one of the big things that HST had that SIS did not have, was the ability at that time for our billing company to do all of our billing through HST. Plus, it's just a lot easier with the blocks. There's check boxes, and just signing on the iPad is great. The other system, you had to use like a signature pad and you had to carry it around, and just using the iPad's a great thing. A couple things that have been good are, so our doctors would always dictate before. So with the template being available in HST, we've actually kind of got them away from dictating, so that we're putting their templates directly into HST, and then they're just putting in the data that needs to be in there if it's something different than their normal procedure for the cases. And then also with case coordination, we're able to actually send and receive paperwork from the doctor's offices. So the doctor's offices will send us HMPs and labs and everything for the patients. And then after the patient's done, we can actually send the op report back to the physician offices, because not all of our physicians work in our clinic. We also have the health system's physicians that work at the surgery centers. So to get that op report to them is important for their billing too. Definitely. It is a great product. For the first year and a half, it never went down. So, and our other system went down like constantly, like at least once a month. So we were like, oh, this is great. And then, it goes down a little bit occasionally, but not as bad, not as bad at all as the other one. And they're really quick on getting it back up. They give you reasons why, and give you solutions that you can use in between. So it's a great product. I really like it a lot. Has a lot of different products that work together. And I really like that idea of HSTs like kind of looking at other products and maybe bringing them into the HST like fold. So you have your patient engagement, the case coordination that they have, and then the new data analytics is going to be a great thing when that happens. And the one screen with everything like all on the one screen eventually, when that happens, that'll be a great thing. I really like the ease of use of it. I don't take care of patients a lot, so I'm doing a lot of the back end, looking at the charts, making sure the charts are filled out right, filled out completely. And in each chart, it's very easy to do that with the percentage on the corner, but also I've just noticed that HST actually has, when you're looking at the e-chart schedule, it has a checkbox next to the patient's name, which means that the chart is totally complete, because before I had to open it up and kind of look and make sure it was at 100%. So that little check mark, I didn't even know like it was new, and I tried it and I'm like, oh, that is awesome. So that was a great thing. It saves me a lot of time from having to open up the charts and to know if they're complete or not. The other thing is with the implants. So with our implant logs, we no longer have that. All the implants are put into the item master, and then they're pulled through each chart when the physician uses it, and it actually takes it out of inventory plus puts it on the op report, so the doctor doesn't have to specifically put what type of implant he's using, because the nurse actually enters that data of the implant into the intra-op chart, and it goes onto their op report. It's a lot easier. We used to have multiple people coming to our management every day with issues. And now it's very rare that they even have any issues with the charting at all. Our front desk people, they have all the patients sign all their stuff on the iPad. So it makes it a lot quicker and easier for them to go through all of that admissions information. And then just being able to look at the chart. One of the other things is the chart, everybody can be looking at the chart at the same time. So there can be two people in the intra-op record at the same time looking at it, and one entering the data while the other one sees it. So it's nice that, in intra-op, they can look and see what happened in pre-op, and what meds were given, and it just makes it a lot easier and a lot, ask questions a lot. I think for sure, like the price transparency and the estimates, that was a big thing for us. Indiana had like a law that actually came out before the government came out that was really much more specific. So we really had to get on price transparency a lot quicker than other people. So the Catalyst product was a great product for us. And then I do like case coordination. I do like case coordination a lot, especially with working with the other offices. We haven't really used it to its full benefit. I know we're going to start using it to contact all of the reps so that they can just get the texts and the emails instead of us actually having to contact them through texts and emails on our phones. So that'll be a great thing when we actually get that up and going. I think for sure, just getting rid of all the scanners was a great thing, and we don't have to make copies. We can actually just print out the discharge instructions. We probably save at least one FTE with scheduling and doing all that extra busy work afterwards, as far as scanning all those documents in that needed to be done on a daily basis. I know that the business office, it's a lot easier for them to use also compared to the other product. So they have time savings too with everything that they're using it for. It's just such a much easier product to use. It's interesting because the doctors, were not real excited to be changing products. I knew we needed to, but they are all about how many clicks I have and everything. And to even try and get them to learn it before we implemented it was just not working. But we implemented it. We were there the day that they started using it, and they picked it up very quickly. I think it's like 7 clicks now, I think, that they have to do. And they were kind of, didn't know if that was going to be okay or not, but they all like it. They're using the templates and getting used to that. It saves them time from having to dictate if the template's already in there. So since we have our 2 centers, we use the enterprise part of HST. And that's been a really good thing too. We were able, when we implemented for the second surgery center, it was actually very easy because we were able to copy a lot of our code tables and item master and everything like that into our new system. And when we use like eChart, you can pretty much just toggle between each surgery center right away, which really helps me when I'm looking to see, who's doing cases at what surgery center and when and how many cases we have. And then also case coordinations really, really like that too. You can just go between, like if our doctor's offices want either schedule at OSMC or at the surgery center at Granger, they can just look at both of them just with a click of a button. I wanted to use the patient engagement tool, but I'm waiting until the meds get in there and the patient information actually goes into eChart, which I hear is supposed to be happening soon. So once that does, we'll also be adding the patient engagement tool, because that'll save us a lot of time. Right now we're calling patients ahead of time, asking them their health history questions, calling them ahead of time to tell them, what time they're coming in, not to eat or drink after midnight, and all of that will be a lot more automated when we're able to use that patient engagement tool. HST does a really good job of looking at the future and finding out what ASCs need, and then going out and either acquiring them or making them themselves. So I think, I expect us to be using HST for a long time. It was a little interesting doing it remote. I had actually been at another surgery center I was at. We had implemented a new EMR, and luckily they were on site. But with COVID, we of course had to do it remotely. But we did it like weekly Zoom sessions. We had classes that we all attended to learn all of the different things that we needed to fill in. A lot of stuff to fill in to start. But then when we did our go live, we really didn't have any issues. We really didn't have to use anybody. I think at the end of the day, I might have called our representative like once or twice about something, but we really didn't need them because we had been really well prepared. It's been great. We get really quick responses. Before we had to put like a ticket in, and it would be months or at least a couple weeks before you'd hear, where here they'll get back to you right away. If they don't know, they'll find somebody else that does know. When we went to the new surgery center, we actually had an issue with our consents. It wasn't bringing over the patient information. So we called our rep, and they got right on the computer and told us exactly what to do. So we were able to finish the day with consents that would be able to be filled out. So that was great. Well, for sure, we can pretty much be totally paperless, which we could not do before. If we have a paper, we just use our iPad to take a picture of it, and it goes straight into the chart. So we don't even have, any additional paper to even scan in. And it is easier. The reports are much easier to look at and look at case costing. We're doing a lot of case costing now. And I know there's a new product out from HST for that, but we're still working on our item master a little bit more before we could use something like that. But that's a big thing. So just being able to make sure that the cases we are doing are profitable with the implants that we're using is a big thing.